work together and collaborate and build a program that is a model. So I've been asked today to talk a little bit about a case history, a case study. I'm going to get to the next slide here if I can do it. And I want to first give you a little background of El Paso County. We serve a population of 666,000 or so. Major metropolitan city is Colorado Springs. That is where public health is located. We also have 7 other municipalities, larger ones including Manitou Springs, Fountain, and Monument. In El Paso County, we have 271 bodies of water at 153 facilities. The majority of our facilities are hotels, convention centers, or workout facilities and schools. Back in 2007, due to the turn down of our economic recession, the Board of Health at that time cut the program due to budget constraints. As Jeff got into, the piece of the statute is really important that only direct costs can be charged for that program or recoup for the program. But even at that time in 2007, the program was really built more on some fees, but primarily per capita or local county funding dollars to fund the program, which that money just wasn't there, unfortunately. But back in 2011, industry members started meeting with me and at the time our program manager, Mike McCarthy, discussing bringing the program back. I found that to be very interesting as the industry wanted to be regulated. And as we time to time see in environmental health, the industry at times will say, yes, we want an even playing field. We feel it's not fair that we have our pool maintained properly, but the folks down the road or across the street, et cetera, theirs is not. And thus they can have cheaper rates for their hotels or whatever it may be. So in 2011, we put a working group together, or a technical advisory group, and started looking at what would this program entail. It was very evident that the industry said, let's focus in on education and critical violations only. Let's really focus in on what's important and use staff resources properly. And they agreed that they would pay for the cost, at least that direct cost, through fees. So we worked very closely with the industry and the staff to develop a logic model, goals and objectives from that. What this slide shows is what it was really important out of what did the industry wanted. They thought it was important that, yes, we protect the health and safety of our community and visitors, but it was more important that we use efficient use of staff resources and effective inspections and training. For example, the folks in Manitou Springs thought it was unnecessary to have multiple environmental health specialists within their community. Maybe one inspecting retail food, another inspecting water rec, another one inspecting on-site wastewater. They wanted one person. So we got real creative and put together kind of a hybrid approach where our staff all do food and maybe they would do some water recreation, et cetera, but definitely the person in Manitou Springs would be able to accommodate all the environmental health needs within their jurisdiction. They thought that was a better use of our resources. So we worked with industry and took their feedback on what they wanted the program to be. And in 2012, we reinstated the program by the Board of Health approval with reinstating fees. And those fees cover with 2 major categories. We have seasonal and non-seasonal facilities, additional bodies of water. So if you go to a facility and they have a pool and a hot tub, they would be charged a flat fee plus an additional body of water based on our estimated time. And then the industry was real big on that they wanted the poorer performers to pay more than the ones that were the better performers. Thus, we created a follow-up fee. So anytime a facility has a follow-up inspection, and I will get on what that entails in the next slide, they are charged or invoiced an additional fee for that time for the follow-up. They thought that was appropriate, where folks did not have to have a follow-up. They were not being charged that fee. So what are the results or the impact of the program? Again, the industry wanted us to be very educational based and more emphasizing critical violations. And when we're saying critical violations, that's a direct link to human health, the public health significance. And the major three that we see in the regulations that would count for closure are no disinfection detected, pH is out of that normal range, or it's high turbidity. Can't see the main drain at the bottom of the pool. So in our first year, 2012, focusing on the critical violations, and only a handful of non-critical violations that the industry thought were important that could lead to a critical violation, we saw a percentage violation rate of 25% critical violations, 7% closure. In 2013, we did see a decrease in the 18% critical violations. However, we did see an increase in 9% closure. We kind of studied that and analyzed that, and we probably it's due to it was the second year of the program, and that staff were probably being more fine line that, or cutting that line that if we did have one of the major three violations, they must be closed, protect human health. But ultimately, the real impact of the program is on the third year of the program, and this is fairly common if you look into the literature when any environmental health program is reinstated. It's usually about that third year is where you really see the reduction in critical violations. And we're proud to say in 2014, the amount of critical violations went down 10% from our first year down to 15% critical violations. And we're really excited to say that our reduction in closures have went down 50%, down to 4.5% closures. So we're seeing cases of real critical human health issues that has been drastically reduced, thus meeting our mission of having safe water recreational facilities. And just last week I looked at the 2015 data, and the 2015 data is a little bit, couple percent lower than 2014. So we're thinking we've hit that baseline factor that the program doing its job will probably maintain around the 2014 numbers, which are drastically less than 2012 and 2013. We've really focused in on education, and with the help of the National Swimming Pool Foundation and a wonderful intern that is now our staff member, Ankit, in 2014 we did a couple workshops geared at our certified pool operators and those that manage the water recreational facilities. And we're going to do another one of those this year, but that program was a 2 to 3 hour work session at the health department where it was free for all of the certified pool operators and those involved in the water recreational facilities to come. We had exhibitors, we had presenters. It was all about water recreational safety, how they can get over some of their challenges with disinfection and those kind of challenges. So we saw a great decrease just after that workshop, and I think that's a good collaboration with the National Swimming Pool Foundation that we want to do in the future. And we probably feel that those events in some ways are even more effective than an actual inspection. So we want to continue those educational efforts. And this year we also want to do a survey with our industry, our advisory group, get them back into the room, see how the program's going. We'll be on our fourth, fifth year of the program reinstated, want to get feedback from them, see if we're using staff resources properly and effectively. But bottom line, we do have a program that does cover all the direct costs through fees. We have a program that is drastically reduced the critical violations that are an imminent health hazard, thus a closure. And we're real proud. I'd love to see that 4.5 closure down to about 2% at the highest, but we know that on any given day there can be challenges in water recreational facilities, thus it probably will remain around that percentage. So from that, I will turn it over to our next presenter, and I will turn it over to you.
Great. Thanks, Tom. Good morning, everyone. My name is Brian Hlavasek. I'm with Tri-County Health Department, and I'll be covering today for Adam Richardson of Colorado Pool Systems for the Aquatic Industry Perspective, who unfortunately could not make the webinar today, but did put these slides together. Advance here. So in talking with Adam, one of the challenges they face is the definition of plan review requirements and submittal procedures. In jurisdictions in Colorado where there is a local inspection or oversight program, they certainly submit plans for review and approval. However, in jurisdictions where there is not a local program, in Colorado or nationally, they obviously do not submit plans. And from his perspective, they really value a local or state oversight contact to get another set of eyes on their plans. And he mentioned, contractors do sometimes make mistakes. However, and having this plan review is valuable to avoid issues down the road. In terms of the plan review submittal requirements, he's listed out several areas here where the current Colorado regulations do not address. And I won't go through each of these one by one. However, the point is the regulation needs to be more specific with much more detail and technical specifications, which he believes that the Model Aquatic Health Code does provide. In things such as plans and specifications, chemical storage and hazardous materials, plumbing, ventilation, signage, material safety data sheets, and those types of things are all important to address. And as I've alluded to, the current Colorado regulations are vague and too much is left open to interpretation. So here Adam provides an example of about how a requirement for a deck area that includes 5 feet of unobstructed deck can be left up to interpretation. So having a regulation that is clearly defined helps to streamline and minimize the plan review process, reduces variance requests and requests for alternative designs that are not specifically addressed. Adam also suggests that the new regulation incorporate new sections and updates to existing sections to include a variety of things such as updated definitions, Virginia Graham-Baker requirements, ADA standards, spas, those types of things, and a variety of other technical specifications and features including water slides, lazy rivers, infinity edges, and interactive water features, etc. And additionally, nothing in the current regulations address disinfection options such as UV or ozone or salt electrolytic chlorine generators. So addressing these aspects and how they can be used will reduce the errors and problems down the line. In terms of maintenance and operations, it's helpful for the new regs to address the operations of the pool in a much more detailed and robust way. Things such as maintenance and equipment checklists, cleaning lists and frequency guidelines, backwash procedures, record keeping, inspections, emergency response, and evacuation procedures are all helpful to assure that the pool is properly maintained and operated. Lastly, it's important to include some specifics around employee training and education, which he believes, and I think we all believe, is critical to having a well-operated aquatic facility. And ultimately, it would be ideal to have the same set of standards and regulations nationwide, which would be a tremendous help to pool designers and others working in the industry. So with that, I believe it's time for polling question number 2, and I guess, Kelsey, if you can make that available and give 30 seconds or so for that. Thank you.
I'll give everyone 5 more seconds. All right, thank you, everybody.
All right, this is Jim Rada again, and I'd like to introduce our next speaker. This is An overview of the alignment of the current Colorado regulations with the Model Aquatic Health Code. Craig Sanders will be leading off and assisted by Steve Chevalier with Tri-County. Craig?
Well, good morning. It's a pleasure to be with you today to talk about some of the issues that we're going to be facing when we look at any changes in the code. And let me move, oops,
Did you just disconnect us?
I think we just got disconnected here. Can you hold on just a second? Let's get it back. There we are back. Thank you.
Just use your button.
Just this one.
Try it. Or your
There we go.
forward.
Okay. And I saw from the poll that it looked like about 20% of the people who are here with us today really don't know much about the MAHC at all. So I just wanted to talk briefly about how the code came about and a little bit more of what it actually is. For most of us, when you revise regulations, what tends to happen is you do some minor changes around the edges. You might change a few terms, you might add or delete a couple of things, but for a lot of us, we just don't have the time or the resources to devote to an in-depth study of how to really rework a code and make it more responsive to the current needs. And in a way, that's kind of how we revised our state septic system code. Typically, it was just done incrementally, but the last time we went through it, we set up a bunch of steering committees and technical committees that really took a good look at it and looked at the current best practices and came up with a code that is much more reflective of what actually happens in the industry. CDC started the process in 2005 by they had a workshop that they had in Atlanta, and the desire was to talk about a process where a code would be developed that was data-driven and knowledge-based. And this is kind of what we have for the Model Aquatic Health Code. So they set up steering committee and they set up technical committees, and then they proceeded to develop modules, which we'll be talking about a little bit in more detail. These modules were all posted for comment and discussion and consideration. And then in 2014, the Model Aquatic Health Code, the first edition was available. And I'm going to turn that over to Steve now to talk a little bit more about the code and the annex.
Sure. Yeah, we just wanted to take an opportunity to get everybody on board with how the Model Aquatic Code is set up and just the different components of it, and then we'll take a look at how some of those components might be able to be incorporated into regulation revision. So the Model Aquatic Health Code and the tour, or Annex Tour, it includes this table of contents, the user guide, glossary of the code, facility design standards and construction, facility operation and maintenance, policies management, resources, and appendices. First off, here's the table of contents. It starts out on Roman numeral page 7, and it really drills down to a detailed level of guidance to specific sections in the code. If you take a look on the section that I pulled there for decks and equipment, you can see how detailed it gets, and it provides for a really good resource when, as a regulator or a designer or operator, when you're trying to look up stuff. The user guide, it provides an introduction to the structure and organization of the code. So somebody that's new to the code can take a look at this user guide and figure out how it's laid out, what the different colors mean, what the different sections are. And it also provides an introduction to the code annex. The annex is really the heart of the Model Aquatic Health Code. It provides the explanations of recommendations, it discusses the rationale, and it also provides a scientific basis for each of the recommendations or requirements. In addition, it notes where additional research is needed, looks at the terminology used, and also provides illustrative materials that support the other recommendations within the code. The glossary that starts on page 54, again, provides a really good detail, attention to terms, phrases, acronyms, and initialisms used throughout the code. Another great resource. Facility Design Standards and Construction starts on page 70. And this provides the requirements and recommendations that designers would use for the design standards, as well as regulators in terms of what should be required for plan review process and consideration, including facility location, intended use, sizing criteria, and really gets down to the minutia of different components for things like deck joint widths. Facility operation and maintenance starts on page 201, and this provides a detailed review of the requirements for facility permitting, inspections, variances, closures, basically your daily operating procedures, as well as seasonal maintenance plans. Policy management section starts on page 250, and this provides guidance on the requirement for staff training, what should be required in those trainings, required staffing for different types of aquatic venues, safety plans, facility management operation, and also planning and response for feces, blood, and vomit. The Model Aquatic Health Code resources, this is only located in the annex, and this documents all the sources used for the rationale of the recommendations in the code. The appendices just provides additional information on how the formulas and calculations were derived, and it's discussed in the annex. And we wanted to point out a few different links here. I believe Kelsey said that we would be able to provide this presentation later. The first link there is to the CDC website for the Model Aquatic Health Code. The second link is for the PDF of the code itself. And then the third link there is for the annex, and hopefully we'll be able to send that out. If not, you can go to the CDC website and find those there. Something else to consider taking a look at is the Council for the Model Aquatic Health Code. The Council works to educate anybody that's really associated with an aquatic venue, so regulators, designers, and operators, and they promote its updating and adoption throughout the U.S. Another one of their charges is to invite public health industry leaders, and industry leaders to vote on the code. So this is a time that you can get your voice heard on what you think should be included or excluded on the code when it's up for the voting during the biennial conference. So it's the opinion of this work group that all the aspects of the current Colorado swimming pool and mineral bass regulation could be updated to meet current industry standards and reflect science-based research that could support the rationale behind the requirements. Some of the benefits of using the Model Aquatic Health Code during a proposed regulation revision include the fact that it's nationally uniform. It's been collaboratively developed from science and best practices with input from industry and regulators. It focuses on the reduction of recreational waterborne illnesses, drowning, injuries, and chemical exposures. The document's all-encompassing and provides a base for aquatic facility design, construction, operation, and maintenance. It's a data-driven, knowledge-based risk reduction effort to prevent disease and injury and promote recreational water experiences. For regulators, it helps us speak with one voice nationally as to what's required to protect the public, what's important, and what alternatives for compliance may be accepted. And then that annex that's provided to offer further explanation, discussion of scientific basis, areas of needed research, and rationale for the content. The Model Aquatic Health Code provides a strong working foundation to move forward with a local regulation revision. While the current Colorado regulation has served the state for almost 20 years, there are areas that, more areas than not, that need to be updated to reflect today's technology, designs, facility functions, and scientific research of aquatic venues. The Model Aquatic Health Code User Guide, Glossary, Facility Design, Standards and Construction, Facility Operation and Maintenance, and Policies Management sections each have benefits that could be considered in the revision of local regulation to provide content that is currently missing. The User Guide section that we discussed earlier could demonstrate to the user how the structure of the regulation document is formed. The glossary can provide definitions of terms and phrases in the document. Attention to the terms and phrases should be detailed to reduce the amount of potential for interpretation issues. The facility design standards and construction of the Model Aquatic Health Code provides a level of detail and specificity that could not be ignored in regulation revision. All aspects of planning phases for design, documentation requirements, the ability for a designer to submit technical documentation to demonstrate acceptability for use, provisions for addressing ventilation, infinity edges, and so on are things that we could pull from the Model Aquatic Health Code and incorporate it into a regulation. Also, the facility operation maintenance section covers operating permits, variance procedures, requirements for preventative maintenance, and again, on and on and on, just with all the detail that's in the Model Aquatic Health Code. There's something that we should consider adding into a regulation. And then finally, the policies management section could also be added as it provides guidance on the recommendation for staff training, training course content, required staffing, safety plans, as well as patron-related management topics. And from there, Craig, I'll turn it back over to you.
Thanks, Steve. Oops, one too many. What we want to talk about just a little, to give you an example, is how the Colorado regulations, as they currently stand, would compare with the MAHC. Now, the Colorado regulations are about 30 pages. The MAHC is several hundred. But just to give you an example, this is what the current Colorado regulations have when they talk about sand filters. And this is it. This is all that is provided. It's not really clear on many of the requirements. It's open to a lot of interpretation. It doesn't really differentiate between the types of different aquatic features that we have. You've got spas, pools, lazy rivers, you have splash pads. Some of these things weren't even anticipated when the state regulations were revised. And if you were to take a look at the Model Aquatic Health Code, now one of the nice things that is available is a search feature, which really allows you to type in a particular term. In this case, sort of in the top circle there, I've typed in filtration, and it will give you all the instances in the Model Aquatic Health Code where filtration appears. As you can see down at the bottom, there's 135 specific references to filtration. And this would include all types of filtration based on the types of features that are encompassed. And so as you can see, there's a lot more specificity when it comes to filtration. Well, the questions that people would ask, well, filtering what and filtering how? A lot of these things are going to be answered when you go to the Model Aquatic Health Code. So it does provide a lot more specificity. And just to give you an example here, move on one more page. The search tool will bring you up the specific information that you're requesting and in any place that you find it. For example, here we're talking about filtrations, and we're talking about water play or interactive water play aquatic venue features. The terms tend to get a little long, but at the same time, they're much more specific in really delineating exactly what we're talking about. So there'll be some discussion about the text itself, as you can see there at the top, and then below the line where it says annex information, this is where we're going to get the backstory. This is how, what it actually means in terms of the context itself and how it's being used. So this is what I think is one of the best things about the Model Aquatic Health Code, because sometimes the regulated community will ask, well, where did you get that number from? Or where did this come from? Did you just pull this out of a hat somewhere? And one of the big benefits is the annex says, no, this is how it was considered. This is the basis on which we made those determinations. And so I think that at that point, it's really helpful in letting people know that this is a carefully considered document that took into account a lot of feedback before we actually came up with the information that's set forth in the code. Now, the other thing that sometimes people get a little concerned about is they think of the MAHC as another federal regulation we're going to have to follow. It is not a federal regulation. There's no requirement that the Model Aquatic Health Code be used or that it be adopted in any way. What it is, it provides a framework for states and municipalities to adopt their own codes. Now, certainly a lot of time and effort has been spent in the MAC. A lot of discussion's been had so that it's as clear and as scientific as we can. The MAC can be adopted verbatim. It can be adopted by reference in another code. It can be amended based on the local desires. And one of the key factors, I think, is that administration enforcement is really covered only generally in the Model Aquatic Health Code. For example, do municipalities or states or counties, do you want to license a pool, charge a fee? Do you want to charge an inspection fee? As Tom is doing in El Paso County, do you want to charge follow-up fees? All of that is left to local control. So there's no typical requirement that this happen in any way. So I think that that's one of the messages that we want to make sure that we understand is that this is not a top-down requirement from the federal government that certain things happen in certain ways, but nonetheless it's going to provide a guideline for how we proceed with this. And I would also put in a plug for the committee for the Model Aquatic Health Code. It's $40 to join the committee. Based on that, you'll get to have a voice in revisions of the Model Aquatic Health Code. And I think, as we all know, one of the most important things is that you have to be at the table. Now, this is a big table, and there's a lot of chairs, but people have to make the decision to walk in the room and sit down at the table if they want to really be a part of the process, assuming how we want to proceed there. So get involved, stay involved is, I think, the important message for the Model Aquatic Health Code and any revisions that we want to make.
Thank you, Craig. And we'll move on to polling question number 3. Kelsey has brought that up. Let's give this 30 seconds. Pull the screen down. Oh, the corner. Not sure.
I'll give everybody 5 more seconds. All right, the poll is now closed. Thank you so much for voting.
Thank you. So I want to just again thank everybody who has sat through this webinar this morning. Just give a couple of comments for the next steps as this small working group will be moving ahead. We intend on following up this webinar with a very brief SurveyMonkey to get a little bit more information as to interest in moving forward, and kind of getting some more specific information about who might be willing to participate in a stakeholder process, both in the development of the stakeholder process as well as the implementation of a process that is developed. We hope then that we would initiate, based on the information that we do receive from the survey, that we will initiate some work this summer to move forward. The survey should hopefully be out within the next week, and we intend to send that to our entire mailing list as well as the list of attendees today, to see if we can get a little broader stakeholder input than the 57 or so that are on this call this morning. I'd like to move on to the next slide here, and we're going to move on to some questions. Please feel free to enter your questions in the chat box if you have any. Kelsey, do we have the ability to take verbal comments?
I would go with the chat box after what happened earlier. I
Okay.
apologize about that.
No problem. I see that Michelle is typing. And we'll take these questions in the order that they're received. While we're receiving questions, I'll just also say that this webinar, you'll see the link on the slide here, this webinar, and any other documents associated with our initial stages of this revision process. We will be setting up a web page with the National Association of City and County Health Officials, and we will make sure that we include that link in any future emails that we send out or any future work that we do, so that anyone who is a part of our stakeholder process will understand where they can access the information. So we have a question from Michelle. Apartments, condos to be added. Any thoughts? Anyone of the speakers have a thought on that?
This is Craig Sanders from Jeffco. That's a very good question. Some jurisdictions, if you'll look some places in Florida and California, they do cover apartments and condominium complexes. But I think that's an administrative decision that would be made probably locally as to whether they wanted to include those. It's not required under the Model Aquatic Health Code by any means. So that would be a discussion with the local stakeholders to see whether they determine that's appropriate or not, I think.
Does anyone else have any additional comments on that? All right, we'll move on to Aldo. What about existing facilities? If this is adopted, the MAHC does not address if they will have to upgrade systems. Again, open to any speaker this morning.
Well, this is Craig again. I can put my 2 cents in on that. That is another thing that you have to determine at what level do you, or at what time do you want these systems to be upgraded, because many of these pools might have been built in the 30s, 40s, even earlier, and so some things they may be able to change out if there are requirements for filtration or disinfection. That may be possible to do relatively easy, but some of the other things in terms of recirculation ratios may not be able to be accomplished just with the physical plumbing that they have. So it may be possible to have a phased-in process where certain things will be required to be upgraded within 1 year, 5 years, and perhaps other things may wait until there's an extensive remodel of the facility. But again, that's a local thing that we can consider if we're proceeding along those lines.
It may also be something that we want to consider as building some enabling regulation similar to what we've done with the on-site wastewater regulations, where there are sections that are opt-in, if you will, that a local agency might be able to opt into inspecting private pools like apartments and condominium complexes. And I see Josh Williams from Garfield County. The semi-public pools were an issue in Indiana, that they were notoriously mismanaged. In Colorado, semi-public pools are your hotels and health clubs and things like that. In Colorado, apartments and condos are considered public and are currently not regulated, or private, I'm sorry, and currently are not regulated. So, Ben White, question, isolation tanks are also an emerging issue not covered in the MAHC. We will need to look at. Oregon, Washington, Colorado have established facilities. Comments on isolation tanks?
This is Steve from Tri-County Health Department. We've seen these pop up in our jurisdiction too, and I totally agree. It'd be great to get some kind of regulation on these, because right now we can't really approach them with the regulation that we have.
All right, other questions? I see comments from Jeff Lawrence and Josh. Yeah, definitions are really critical to all regulations. I think we would want to spend and take particular care in defining the things that we want that would be included in the state regulation. Susan Wickman comments that the MAHC will continue to evolve to include topics like float tanks and isolation tanks. I imagine since it does include things like splash pads and other types of aquatic features, recreational aquatic features, I think as time goes on, new things will come up and we'll definitely have to address those. My hope is that should we go through this process and adopt revisions to statutes and or regulations, that we then build in a system in Colorado by which these regulations are reviewed on a regular basis, similar to many of the other water quality and other public health regulations that we administer. It is important that we not allow regulations to exist for 20 years without updating. So I think hopefully that would be something we would discuss either with the State Board of Health or through the regulatory review process that the State Health Department implements now. So,
Jim, this is Jeff. Thank you for bringing that up. I wish I would have mentioned it during my presentation that 2 executive orders that have been issued over the last about 5 years really requires exactly what you said. We need to look at review regs no less frequently than every 7 years. That's the worst case. So most of our regs that we administer within our division, we look at about every 3 years. It doesn't mean we engage in a robust stakeholder process during that time, but make a determination if we need to. So these decade or multiple decade-long time frames between reg revision is no longer allowed. So that's a good thing. It forces the right action.
That's right. Looks like we have a couple of more questions or comments coming in. Chris Manley, could a MAHC adoption be along the lines of building codes with a statewide adoption and local revisions? Thoughts on Jeff, Lawrence? Do you have any thoughts on that one?
Yeah, I think that's in the statute. That's exactly how the statute's currently laid out, and I would think, Chris, with any changes that would be made in statute, maintaining local control as that's allowed within other programs and the ones you mentioned would be a key component of that. So I would see that as a definite path forward.
Well, I don't see any other questions at this time, and so I would like to thank everyone who attended this morning for your participation in the webinar. You should be hearing from us again within a week or so with a follow-on survey. Please take some time to fill out the survey. We really want to intend to use the data that we're gathering here to really decide what direction that we're going to go. We certainly would encourage you to provide us, if you're interested in being an active participant in the stakeholder process, to please provide your name and contact information so that we can begin to assemble appropriate teams to work on various efforts through this process. We look forward to working more with you, and again, thank you today, and we'll, I think, end at this point. Kelsey, do you have any final direction?
Nope. Thank you, everybody, for joining. I guess you are free to exit out and hang up your phones.
Thank you so much.